What I took from the paper as most important finding, there's a couple. One was tended to highlight the three kind of dominant characteristics associated with this population. And one I'm going to focus on is, I think, isolation. Is that what was referred? Now, isolation, and so I'm going to go right into that because this finding is so valuable in that depression is often brought on by the lack of connection, social engagement and connection. And that's all humans need that. So when I'm experiencing a stress in my life, my tendency is thinking I should isolate and solve it myself. You exacerbate the incidence and the increased potential for more depressive experiences. Right in that finding of your paper, what we took from that was that we do most of our work in groups with men. In fact, 90% of the work I do with men is in groups. Men are comfortable in groups. They do sports in groups. They go to school in groups. They work in groups. So what's going on there? The therapeutic correction begins right away when they move out of isolation into connection or community again. That is one of the findings in the paper, which we take as reinforcing what we're finding in our practice. So if that's a characteristic, and that's highly associated with depression, the antidote to depression is the opposite of isolation. But the cultural value is to isolate when you're stressed. They're totally oppositional. So I think that finding is extremely helpful to people creating programs. Hence, going to a counseling service by yourself doesn't work as well as sometimes we encourage boys in school to go see the counselor, take a friend along with you. But that's even more difficult. The best service is to say there are groups for men, and the groups may be around career, dating, maybe maybe shy of that, but how to be more competent in successful at university. Whatever you label the groups as, once they get into the group, they become quite cohesive and then quite self-reflective and quite trusting and quite open. So when they talk about the culture valuing isolation is not what men want, but if they ascribe to that, that's often where they end up going. So we took from the value of that study was how to prevent isolation because it's so aligned with depression. In their research findings related to anger, that's a really key variable in working with men because people get very fooled by angry men. Angry men are not often angry. Angry men are expressing anger, but frequently that's called a secondary emotion. The primary emotions underneath that are often feelings of failure, inadequacy, hurt, and shame. So if those are the feelings that they have, or they're belittled, but the only acceptable way to have any emotional outlet is to get angry, then that's what's expressed, and it frequently gets misdiagnosed. In fact, you know that depression may be manifested in a very angry man because they may have extreme low self-esteem, but it's expressed, quote, as acceptable as angry, and it's modeled as in sport, it's modeled in hero characters in television, video games, and so on. That I see that in our work as really people who are angry are usually feel very threatened inside, that kind of anger. So we use that in our diagnosis as not an information statement about what's going on, but a symptom that they may in fact be depressed. And a lot of people don't think of acting out anger as a sign of depression. Or they may be extremely anxious. And anxiety and depression, of course, go hand in hand. But of course, the difficulty is males often don't pay attention to when they are depressed. They will tend to normalize it because they aren't awfully reflective about why that is. I'm just not feeling as good, or I'm getting into trouble, or I'm acting out more. So I think, again, the term faux masculinity are kind of like I think there's a false masculinity, or a masculinity which sets many of them up to not actually access the very thing they need: support, understanding, to move out of the depression. And of course, we have a lot of success in that once they enter.